I'm gonna let you in on a little secret. It's what I like to call the fast track to nest leader burnout syndrome. Right now, thousands of nest leaders are chasing a sense of accomplishment and career growth. They are convinced that if they work long hours, sacrifice their health, well-being, and important relationships for a job, they will get a bigger promotion, earn more, and feel more accomplished. But there's a hidden cost. Burnout syndrome, which presents as high levels of emotional exhaustion plus depersonalization, where you feel as if your mind, your feelings, your body are outside of yourself. You feel unstimulated, dissatisfied with this nagging feeling that your years of dedication are not being financially rewarded or acknowledged. The risk increases if you're female, married with kids. Meanwhile, one of my clients is taking her years of nursing expertise and packaging it into consulting services which she can offer with full control over her own schedule, having full flexibility without needing to get another certification. There are two paths. Path A, work a traditional role as a nest leader, working long hours because the work and responsibilities are always increasing, reduced satisfaction with your job, lack of support from peers and leaders. Path B, become an independent nest consultant with full control of your time, schedule, impact, and income. I have taken both paths and Path B wins every single time. Let's talk about Path B, how to transform your nursing career by becoming a nurse consultant even if you're a beginner, and why longer hours and chasing elusive promotion as a nurse leader isn't a metric for success anymore. But before we get into the details, if you haven't subscribed to this channel, be sure to do so now. Nurse consulting is a specialized professional service where experienced nurses utilize their clinical expertise, administrative skills, and knowledge of healthcare systems to provide advisory, educational, or operational support to various industries. These industries include healthcare organizations, educational institutions, legal teams, insurance companies, and private clients. And in case you're sitting there doubting yourself, you don't need another degree, certification, fancy tech skills, or some other knowledge outside what you already know right now in order for you to be a successful nurse consultant. Why nurse consulting is the fastest path to utilizing your current and existing skill set in becoming your own boss. Once you learn to acquire new clients, the opportunities are endless. You have flexibility and full control over your own time and schedule. Talk about a normal workload, which significantly reduces the risk of burnout syndrome, emotional exhaustion, ill health, and compromised relationships due to excessive work hours, increased and scalable income, and you get to make an impact whilst doing work you love. There are 4 phases to getting started with nurse consulting as a beginner. Setting a vision plus timeline, discover plus package your nurse consulting services, mastering client acquisition, 4, your framework, and having a lean workflow. Let's dive into phase 1. Setting a vision plus timeline. If you want to set yourself up for the most success, start with the end in mind. What would your life look like if you were a successful nurse consultant? How would your life change? What impact would you make? Your vision needs to be a stark contrast to where you are right now. If you're currently feeling stuck in a hostile work environment, doing long hours, unstimulated, dreading waking up each day, bored and ready to quit, what's the opposite of that? The trap most people fall into is they don't know what they want. Don't let that be you. They vividly know what they don't want. In fact, they talk about what they don't want all day. As a result, they keep gravitating towards what they don't want. Make sure your dream is vivid, exciting, and well defined. Your dream can be, I am flexible and have full control over my work schedule and earn $10,000 more. It is the opposite of the biggest pain point that you're experiencing right now. What timeline are you giving yourself? Is it weeks, months, years? One of my clients, Geraldine, is approaching retirement, and Nurse Consulting is her plan for maintaining her lifestyle, income, and fulfillment after retirement. If that's you, serious about using your nursing expertise as a nurse consultant and want to work with me directly, click the link below and book a free consultation call. I transitioned in a matter of weeks, but you can set your own time frame for making a transition. Now on to phase 2. Let's help you discover plus package your consulting services. First of all, there are countless consulting services for you to offer. Your job is to discover what that is based on your current nursing expertise and package it into a service that healthcare providers willingly pay for. The key ingredients to discovering what to specifically offer are personality, your nursing experience, the big healthcare problems within your specific industry, and market gap validation. Let's take a deep dive into these 4 components. Understanding your personality helps you create a business you love, unlike the job that you're now resenting. Your personality is one of the most important guiding factors to your behavior as a human. It's your unique combination of qualities that make you who you are, including how you think, feel, and behave. It's a complex area of study in psychology and is defined as your enduring characteristics and behavior that comprise your unique adjustment to life. You will start to feel out of alignment when you spend a long time doing work that is not in tune with your strengths and weaknesses. But as for you, your story changes now. You can now wake up excited about the work that you do. How do you then translate all this into a profitable nurse consulting business? It starts with you understanding your personality type, its strengths, its weaknesses, and ideal environments which enable you to thrive. To find out your personality type, go to the nearest Type Explorer test for its simplicity and high possibility of accuracy. Its format is similar to that of the Myers-Briggs, which most of us are familiar with. Once you get your results, pause and ask yourself this question: what is the career path for my personality? Does it align with my current career path? Ingredient 2 in uncovering profitable consulting services to offer is experience. Never ever underestimate the power and value of what you know and have accomplished. This is the biggest weakness with many nurses. They undermine and undervalue themselves, therefore they are underpaid. If this is you, this stops now. If you're under-earning and underutilized, you're probably feeling resentful and unappreciated. You get no brownie points for this. Look back on your nursing career and identify what your healthcare expertise is. This is an expert skill or knowledge in a particular field or area of your work. Hint, this is usually something you enjoy doing and you're really good at. Are you an expert in wound management? Do you excel in building strong teams and a positive work culture? Have you increased staff retention? Are you your organization's go-to person for regulatory compliance? Think back and list at least 3 projects or roles that stand out. Ask yourself, what were the main problems when you arrived versus the solutions you implemented and the outcome after you had implemented those solutions. Try and focus on work that you enjoy doing and you want to do as a consultant, and avoid things that you hate doing. If you are a director of nursing in a long-term care facility and an expert at regulatory compliance and leadership development, then a main problem when you first arrived could have been decommissioned, facility was sanctioned, lack of strong leadership. Facility allocated high-risk status due to clients with avoidable pressure injuries. The solutions you implemented included: introduced and implemented leadership development and training for the key leadership team, identified the root cause of high-risk incidences, provided education on regulatory standards, and introduction of regular auditing, hurdles, and team building activities. The outcome of your work was regaining and maintaining of accreditation status, a stronger team, lowered risk rating to patients, and a lower staff turnover rate. Now do the same for 2 other projects that stand out for you. Make this as thorough as possible, as this will be the foundation to a profitable and sustainable growing nurse consulting business. Ingredient 3 is understanding your specific industry problems. As a consultant, you are a problem solver. In fact, always remember that you specialize in identifying and solving problems. The bigger the impact of the problems you solve, the more you're paid. Identify the 10 main problems that your specific healthcare industry faces. You can easily find this in the news, Google, regulatory websites, or what the locals are saying about a particular healthcare provider. Then bring together the data from your personality type, your experience, the problems in your healthcare industry, and extract 3 to 5 nurse consulting services that you can offer. In order to make this profitable, validate with actual healthcare providers that there's an actual need for this problem by calling them, having conversations with them, and asking them about the specific problems and challenges that they're facing. Mastering client acquisition, which is phase 3, starts with creating a customized nursing proposal and having conversations with your potential clients. This is where you go from kept income and years of feeling underappreciated and under-earning to scaling your income and having full control over how much you earn. The fastest way to land a client is in person, but where this is not possible, Zoom or video call is your second alternative. Lastly, telephone. Build a database of potential clients so that you have repeating and consistent income. The last step in transforming your nursing career, which is phase 4, is having a framework and mastering a lean workflow. What framework will you use to solve your clients' problems? You can utilize the nursing process, which is assessment, so assessing your clients' problems, planning, the course of action, implementation of solutions, and evaluation, where the actions actually effective. In order to succeed, be highly effective, efficient, and maintain lean business operations that prioritize providing high quality work. This will build your reputation and lead to recurring business and revenue. Now that you know how to transform your nursing career and become a nurse consultant, even as a beginner, this is where the impact sets in. Rather than dreading waking up in the morning, feeling emotionally exhausted from burnout syndrome, you are energized and excited by your work, because you know you're making a real change. And if you're serious about using your nursing expertise in order to build a successful nurse consulting business and want to work with me directly, click the link below to book a free consultation call. If you enjoyed this video, be sure to like and subscribe.